Good morning. This is Michael Munson again. Let's get started because we have a really full time together today, this morning. I'm really excited to be here and share with you information about serving transgender survivors of sexual assault and domestic violence. I'm joined today both with Nebraska Coalition staff as well as some of Forge's staff, Lori Cook-Daniels and Katie Taylor. So we're all really happy to be here. This webinar is a general overview, so it's going to be highlighting some key aspects that many advocates and providers working in sexual and domestic violence may want to know to better serve transgender survivors. So consider this a little bit of an overview, and we'll point out some areas where you can learn more in-depth information if you'd like to pursue some of those different areas. So I'm really glad that you joined us today. I'm very grateful that the Nebraska Coalition reached out to us and asked us to be part of this webinar today because it's a great opportunity for us to learn remotely and share this space together. So thank you all for being here. So some of you I know have been on Forge webinars in the past, and many of you have seen this image, and we like to always start with both a welcome, because we're really glad that you're here, as well as some housekeeping. So we really encourage you to take care of yourself. We know that sometimes the content that we talk about, even if we work with it every day, can be sometimes painful and sometimes difficult to hear. So what I'd like you to know is that please do what it is that you need to do to take care of yourself, and know that we'll be sending the PowerPoints after the webinar, as well as we'll be recording the webinar so you can listen to it at any point in time afterwards. So it's generally up within 24 to 48 hours after the event. So please know that and do what you need to do to take care of yourself throughout the webinar. So one piece of housekeeping again with the navigation tools. A lot of you are familiar with webinar software. Most of it's pretty common, but if you have questions throughout, please feel free to type those questions in the question box. We have a couple of people that are monitoring that area. This will be where you can ask both technical questions if something's not working, as well as questions about content. We'll probably save all of those questions until the end, so please don't think that we're ignoring your questions if we don't get to it right away. As I hope that you've seen, we have a worksheet that will help kind of guide us through the majority of our time today. So if you haven't downloaded it, the URL is on the screen right now, and it also should be in that control panel of the webinar software. So I encourage you to download it or print it or have it in front of you. If you can't do that, it's totally fine, and I think you'll get just as much out of the webinar without having that in front of you, but it might make it a little bit more fun and exciting. So let me turn things over for a minute to Michelle from the Nebraska Coalition, and she can share a little bit about the coalition.
Good morning, everyone, and welcome to the webinar. I want to echo Michael's comments about just being very pleased to be able to work together to sponsor this webinar with Forge, and we are really excited to have them as the presenter for this webinar and to hear all of the great information that they are going to share with all of us. The Nebraska Coalition to End Sexual and Domestic Violence is a statewide membership organization that works with our local domestic violence sexual assault programs across the state. Nebraska is primarily a rural state, and so that's one of the areas that we sometimes struggle with in working with a variety of different needs with various survivors. One of the things we are webinars every month, and this is of course one of them. One of the things that I would like to let everyone know is that if you would like a certificate of attendance for this webinar, please contact me. You have my email address and the phone number on the screen. I will send out a certificate of attendance. Might take a day or two after the webinar, but we'll get those out as soon as we can. You will also receive a link to an evaluation after the webinar ends. We really encourage people to complete the evaluation. It should only take a few minutes of your time, and please give us feedback. We use those here at the Coalition to improve both our webinars and our in-person events, and feedback is really crucial for us. We'll send a follow-up email in a few days with the link in case you're really packed today and you don't have a chance to do it right after the webinar. And we will, of course, share all that information with Forge as well as the presenter of this webinar. But otherwise, welcome everyone. I'm so glad to have such a large attendance at this webinar, and I will turn it back over to Michael. Thank you.
Great, thanks a lot. So again, we have a really packed 90 minutes today, so I'd like to keep us rolling and moving along quickly. What we want to start with today is some discussion around some trans basics, because we know that everybody comes from a slightly different perspective about knowing who trans people are and knowing who trans survivors are. So we'll take a little bit of time looking at some basically 101 issues around trans people. We'll then shift over to Laurie Cook-Daniels, who will talk about data, and we'll cover some basic data about trans violence rates, kind of mostly geared towards prevalence rates, and a little bit of some other interesting data that you might find valuable. We'll spend a great deal of time today talking about trans-specific barriers, and how we've set it up is we'll talk about a barrier, and then we'll try to add in some rural implications of how that may play out. We'll talk very, very briefly about shelter and safety planning. That's a topic that we could be spending days talking about. So I'll point you to some resources, and we can potentially have some future conversations about it. And then we'll end today talking about some practical things that you can do. And I'm hoping that we have time at the end for questions. So that's our basic agenda. Let me tell you a little bit about who Forge is. We are basically a trans organization who is 100% funded and focused on anti-violence work related to trans survivors. And I say we're basically a trans organization because it's kind of hard sometimes to know if we're a trans organization or an anti-violence organization. But we were founded 21 years ago, predominantly as a trans social support group, and we have since moved into this anti-violence focus in our work. We are headquartered in Milwaukee, Wisconsin, but we have staff that are in other states as well. And all of our work is national. So we have around 75% of our time we do training and technical assistance, so webinars like this, conferences, trainings, and around 25% of our time is doing direct services with transgender survivors and loved ones. And all of that work is virtual, so by the internet and not usually in person. So we have two foundational principles that guide all of our work. When we engage with both survivors and providers, our first goal is to approach the work through a trauma-informed lens. And the second foundational principle, again, in how we work both with survivors and providers, is to focus on empowerment. So through highlighting resilience, building on existing knowledge, and promoting a sense of confidence. So this basically, to me, kind of sums down to, we know that you all do your jobs really well, and our job is to help you learn more about transgender survivors so you can do your job well when you have a transgender survivor or loved one enter your office. So again, we have a very small staff, and I know sometimes people like to have kind of an image of who's talking and who's involved. So we have 3 people. I'm the co-founder and executive director, again, for all of those 21 years. Laurie Cook-Daniels is our policy and program director, joining us in 2000, and Katie Taylor is our project coordinator for several different projects, and she joined us in the last year. So new additions. Let me briefly tell you a little bit about what we can offer before we dive into the content. So like I mentioned, we're a training and technical assistance provider, and what that means is that we can definitely offer you one-on-one support. We do webinars like this one, we do a lot of training across the country, and we have publications. Many of those things are on our website. The webinars are we've done in the past. We have, I think, 50 hours worth of webinars that are archived, so we encourage folks to look back at those and have access to that free training. The support that we offer for transgender survivors is oftentimes useful for providers as well. So some of those things that we offer for survivors are a listserv, which is available 24/7 if somebody needs to reach out. We have a fairly large referral database, mostly of therapists and LGBT-focused anti-violence programs. We have run in the past Writing to Heal groups, so an online group that will allow trans folks to access healing services remotely. One of our current projects is the Espavo project, and you'll be seeing some of the photos of that project. It's a photographic and narrative project that focuses on trans survivors' resilience. So you'll see some of those images as we go through today. And the other thing that we offer survivors is some publications as well. And we find that many times the providers are finding those publications directed towards survivors as just as useful as they are. So that's a little nutshell of what we can offer you. So you'll see many images today as we go through, and like I mentioned, many of them are from the Espavo project. This photo, for example, is from 2013, and we've had many, many more since then. Um, we really believe that it's critical to put an actual face to some of the stories and data that we're talking about. And although most of the images won't be directly linked to specific content, we know that providers really want to have a better sense of kind of the who trans people are. And we obviously recognize that seeing a picture is not helping you know who trans people are, but sometimes it helps us feel a little bit more connected to the people that we're talking about. So I hope that the images do help you feel more connected and kind of in line with who we're talking about today. We definitely have permission to use all the images, and we're really mindful of that. Um, and so I hope that you find benefit in seeing some of them. So let's get started with talking about transgender basics. So we really want to make sure that we all kind of are on the same page, or at least in the same book when we're talking about transgender people. So I didn't set up any polls for this webinar because sometimes they're a little bit clunky and difficult to do, but you have a handout, and so this is the first question on that handout. So what percentage of the population is transgender? So the options that we listed are 0.5%, 1.7%, or 3%. And the answer is that it really depends. There's a lot of factors that go into it. We don't really know how many people are transgender in the US or in the country, in the world. The prevalence rates are really difficult to determine because everyone defines transgender differently and includes or excludes different factions of people and identities. In addition, not everyone who has a transgender history would self-identify as transgender now. There are many, many factors that contribute to us not fully knowing what percentage of the population is transgender, and those are just a couple of the reasons. However, it's fairly safe to assume that someplace between 0.3% of the population and slightly greater than 1% of the population is transgender. Because the 1% is more commonly found, we tend to use that as our reference point, so that 1% of the population is trans. You can all do the math on your communities to kind of gauge how many trans people might be in your local area. One of the things that we like to talk about when we frame Transgender 101 discussions is talking about two concepts. And the first one is about master status. And this is something that was developed a long time ago in the 1940s by Everett Hughes, who called it master status. And then about 15 years later, Gordon Allport, in his book, The Nature of Prejudice, named it the label of primary potency. And these two things are the exact same thing. So both terms refer to the tendency of people to believe that one label or one demographic category is more significant than any other aspect of that person's background, behavior, or performance. And that's kind of a mouthful of language that may not be clear. So how this commonly plays out for transgender people is that providers oftentimes learn that a client is transgender and then presume that all things like medical conditions might be related to being transgender, that being trans has caused a sexual assault, that all relationship strains are due to being transgender, that any kind of job loss might be due to being transgender. But the reality oftentimes is that people may have medical conditions that are unrelated to being trans. They may have relationship struggles because they have poor communication. They might lose their job because maybe they have poor performance or don't show up. So we want to be really careful to not make an assumption about we know somebody's trans and so we therefore then think these other things about them. The second concept that we like to talk about when we look at Trans 101 issues is what we call the terms paradox. So terms are really, really crucial. We all, value hearing our name, our pronoun, having words that we use reflected back to us. And those terms are really crucial for providers in terms of showing respect and openness to our clients. And at the same time, those terms are kind of meaningless in that you don't necessarily know what you need to know to provide services to them, appropriate services to the people that you're working with just based on those terms. So an example that I like to give frequently is if someone comes in and says that their name is John Smith, we want to refer to them as John. And if they say my pronouns are he and him, we want to use those pronouns. But that name and those pronouns or that gender marker may not be what's on their health insurance card. So the meaningless part is we still have to bill their health insurance in a way that we're going to get payment or billing for them. So the terms paradox can apply to a lot of different things. It can apply to identity labels or experiences, personal history, body part names, pronouns, or basically any part of or component of who a person is. So if somebody, like I said, says what their name is, that's something that we want to reflect back to them, but it may not tell us more of what we need to know. So who are we talking about when we talk about transgender people? When we hear or see the word transgender or any of the other hundreds of words that might be synonymous or closely allied words, we each have an image of what comes to mind for us. So for each of us, if asked, we would probably describe who transgender people are a little bit differently. And I think that's a really good thing, that we have slightly different definitions of who we think trans people are. So each of us brings with us a different mental image, maybe a different theoretical framework, maybe a different academic construct about what transgender means, and who we're talking about when somebody says the word transgender. And unlike a few years ago, just a few years ago, nearly everyone right now has some kind of connection to trans people or trans issues. For example, the hot thing in the news right now is like 20 million people watch Diane Sawyer talk about Caitlyn Jenner. Others might watch TV shows like Transparent or Orange is the New Black. Others of you may have kids, and your kids are involved in school districts who are adopting trans-inclusive policies. You might have family members or loved ones who are transgender. You might have worked with clients who are trans, or have coworkers or neighbors or other folks that identify as transgender. So I'm hoping by the end of this webinar, you'll have whatever your current knowledge is right now, you'll have a little bit more of an idea of who trans people are and how to better work with transgender survivors who come for services. So one of the things that we've recently shifted to is not defining terms, because we're finding that defining terms just gives folks more labels to assign to people rather than truly understanding who each person is. So I'm going to talk about kind of who is under the transgender umbrella, but not give a lot of those one-to-one terms and definitions. So who are we talking about? So when we use the word transgender, or when we're talking about who is included in this very broad spectrum of people, we are including some of these types of people. So we're including people that are gender non-conforming. So people that may intentionally or not blur stereotypical cultural gender lines of binary gender. So the male-female is binary gender. We're talking about people who transition from one gender to another gender. Might not be from male to female, it might be from male to androgynous, male to something else, female to something else. We're talking about people who are questioning of their gender, or who may not feel like their gender that they were assigned at birth, the sex that they were assigned at birth, fits who they are today. We're also talking about people who don't fit into the binary, so people who may identify with a gender other than male and female. We are also talking about gender conforming people of trans history. And this is something that some of us don't think about very much. So oftentimes people that do transition from one gender to another may live fully as male or female now and don't consider themselves trans anymore, but they do have a transgender history. Other people who we're including under this big umbrella are people who are multiply gendered. So people who may live parts of their lives in different genders at different times, or who may identify as more than one gender. And at Forge, we consider SOFAs, or significant others, friends, family, and allies, under this large trans umbrella. And we do so for many reasons, but one of them is that we know that violence and discrimination impacts both transgender people as well as those people who are close to them. So those are just a little bit of an idea of who we're including under that big umbrella. Sometimes pictures end up speaking a little bit louder than words. So I know that not all of you have access to a screen, but on the screen are 4 images of trans feminine identified people. So just to give you an example, you might hear these people refer to themselves as trans women, women of trans history, transgendered, male to female transsexual, crossdresser, formerly transgender, or any number of other words. For some people, one or more of these terms might be really offensive, but for others, they really embrace one or more of those words. These individuals are assigned male at birth and don't identify as male anymore. So they might be living some or all of their life as women or in a more feminine way, stereotypically feminine by our culture standards. So the next screen is of 4 transmasculine individuals. And again, these individuals may consider themselves or use language like trans men, men of trans history, female to male, stud, drag king, or any number of other words that would describe who they feel they are, who they are inside. And again, people who are transmasculine will really relate to some words, and other people will oppose those very same words. So these are folks who were assigned female at birth and who live some or all of their time as men or in a more masculine way. And then this third slide, just to give us some images to go with it, has the most change and language diversity. So this is these are 4 images of gender non-binary or agender people, and the language has just shifted incredibly over the last several years. And it's critical for us to keep in mind that not everybody identifies as either male or female, or is even heading in one of those 2 directions. So many people identify as multiple genders or no gender at all. Some people intentionally challenge gender binary norms, and other people may live in ways that don't conform to socially constructed gender or reinforced binary types of gender. So people who are gender nonconforming or agender or non-binary in their gender identity or in their gender expression may have been assigned male at birth, female at birth, or in some rare cases, they might have been assigned intersex. They may or may not take steps to socially, legally, or medically transition, just like the folks on the previous slides, but they also may take steps. So one of the things that I hear a lot is people say, I just don't get it. I don't get the language thing. You know, just tell me what the right words are and tell me what the wrong words are. And this is a really difficult thing. And what I tend to tell people is the reality is that the right words are what your client tells you. Those are the right words to use with that client. And conversely, the only really wrong words, and I'm using big air quotes here, the wrong words, wrong language, are using words and phrases that are intentionally in contradiction with what your client has indicated is comfortable for them and aligns with their identity and experience. So how do I get it right is another question that we commonly hear. And if there isn't a right or wrong list of terms and definitions to study and learn, you know, how do you get it right? And the answer is really fairly simple, but it's also fairly difficult. And the answer is to listen, and listen really carefully. And sometimes that's a lot easier said than done. But when we listen carefully and we ask relevant questions, then we listen some more, we ask maybe more clarifying questions, and then we listen some more, we'll generally be treating people with an incredible amount of respect and dignity. So that is a fairly brief Trans 101, and I'm going to turn things over to Laurie, who's going to talk about data. So again, if you haven't downloaded that handout, we encourage you to do so because more of those questions will be coming up through the section.
Great, thank you. Michael, there is a question that just came up on our screen from someone that's on the this webinar saying saying, what are your preferred pronouns, Michael? So would you please model this and respond to that question?
Sure. Most people use he, him, and his for me. I do not have any preferred pronouns. I will respond to just about anything as long as you catch my attention.
So thank you for that question. That was great modeling. So I'm Marie, and I'm going to share a little bit of numeric data about the rates of violence that transgender people experience. Many of you know who Brene Brown is. For those who don't, she's a researcher. Mostly she focuses on shame and vulnerability. If you haven't read her books or watched one of her TED Talks, we encourage you to check her out. She has some very powerful quotes. On the screen is one that is so relevant to the information we'll be sharing next. She writes, "Stories are just data with a soul." As we go through the next slides, we'd like you to keep in mind that every single number we talk about today has a story behind it. Those numbers represent real people's lives. It is sometimes easy to forget that when we are looking at bar charts and percentages. This next quote is an excellent summary and reminder of the types of violence and inequities transgender people often face. It is from the executive summary from the 2011 report Injustice at Every Turn, a report by the National Center for Transgender Equality. They said, transgender and gender non-conforming people face injustice at every turn. In childhood homes, in school systems that promise to shelter and educate, in harsh and exclusionary workplaces, at the grocery store, the hotel front desk, in doctor's offices and emergency rooms, before judges, and at the hands of landlords, police officers, healthcare workers, and other service providers. We are using that data from the National Center for Transgender Equality. That is the source of a lot of our data that we'll be giving you in the next few slides. And a lot of the data also comes from Forge's own surveys, particularly surveys from 2004, 2007, and 2011. So back to the handout. The question number 2 is, what percentage of trans people experience sexual violence? And the possible answers we give you is 18%, 33%, or 50%. The answer is C. Rates of sexual violence for transgender people is between 50 and 66%. Multiple studies indicate that the rates are at least 50%, but some studies show rates as high as 66%. This is compared to the general population, which generally the accepted statistics are about 1 in 3 girls and women, and 1 in 6 boys and men. In one of our early surveys, we asked trans survivors if they believed that their gender identity or expression was a contributing factor in their abuse or assault. Michael mentioned this earlier, that the concept that a master status, when people think that transgender people, oftentimes people think that transgender people who've been sexually assaulted were sexually assaulted because they were transgender. When we asked transgender people what they thought motivated the sexual assault, only 43% said they thought that gender identity or gender expression was part of what motivated their perpetrators. The rest thought that there was a different motive or they didn't know. The next question on your handout is 3. How many transgender individuals have experienced sexual violence when in grades K through 12? Our suggested answers are 12%, 21%, and 35%. And the answer is 12%. This data is from the National Center of Transgender Equality's Injustice at Every Turn. In K through 12, 78% of the children that were identified or visibly trans were harassed based on gender identity or expression. 35% were physically assaulted, and 12% were sexually assaulted. And those rates include abuse by both students and teachers or staff. The bottom of the screen is also important. It has how many kids were expelled, 6%, and how many kids dropped out of school due to the harassment they experienced, 15%. What this means is that as many as 21% of trans young people didn't finish high school because of harassment or expulsion. Some of them may go on to get their GEDs, but many do not. And that leads then to higher risk survival behaviors, such as engaging in sex work or other underground economy activities. Although many youth and adults are resilient in finding some way to survive, when young people are surviving on the streets, they are at much higher risk for experiencing other forms of violence, such as sexual assault, physical assault, stalking, mugging, etc. Question number 4. How many trans people were sexually assaulted by a female perpetrator? A is 12, B is 18, and C is 29%. The answer is C. 29% of the transgender sexual violence survivors Forge studied in 2004 had at least one female perpetrator. Initially, we thought this was a highly unusual finding, and so we started digging into the literature. It turns out that there are many studies of the general public, not just those who present to police or rape crisis lines, that indicate that women make up approximately 1/4 or more of sexual assault perpetrators. On the left side of this slide, you can see that 12% of the perpetrators were trans. When looking at a marginalized population, we often only look at rates of violence against them, not perpetrated by them. It's important to remember that trans people, just like everyone else, are capable of sexually assaulting someone else as well as of being a victim. Question 5 is how many trans people are physically assaulted by a healthcare provider? 16%, 26%, or 36%? The answer is B, 26%. That means that 1 in 4 transgender people have experienced physical assault at the hands of a healthcare provider. In addition, 10% have experienced sexual assault, again, in a healthcare setting. For those who haven't directly experienced physical or sexual assault by healthcare professionals, many have been turned away and denied services altogether, and most have heard accounts of negative experiences from friends or other people in the community. For these reasons, it is easy to understand why some transgender people may fear or avoid healthcare settings or seeking medical care, even after a sexual assault. Next question is, domestic violence is lower, the same, or higher for trans people compared to non-trans people? The answers of both B and C are correct. Rates of intimate partner violence are roughly the same for people of all gender identities and sexual orientations. There is some newer research that is suggesting that rates may be higher for transgender and lesbian, gay, and bisexual people, but the data is still not conclusive. The next question on your handout is, of trans people who access homeless shelters, how many are sexually assaulted? 22, 25, or 29%? The answer is A, 22%. Transgender people are particularly vulnerable in homeless shelters. We mentioned earlier that many transgender people are unemployed due to anti-transgender job discrimination. This and other factors have resulted in a substantial number of transgender people using a homeless shelter at some point in their lives. In many communities, domestic violence shelters are full and or have not made the necessary changes in their policies and practice to house transgender survivors. When domestic violence shelters are not available, those who need shelter often seek homeless shelters. And yet 55% of transgender people who have tried to access homeless shelters were harassed there, 25% were physically assaulted, and 22% were sexually assaulted. Perpetrators were both staff and other residents. Trans women's rates were higher than trans men's, and people of color experienced more violence than white people. It is highly likely that even more abuse would be happening in homeless shelters if transgender people were not leaving due to poor treatment. 47% of transgender people who try to access homeless shelters end up leaving because of how they are treated. Although HUD rules and other federal laws are changing quickly to include non-discrimination clauses that include gender identity and expression, many shelters, both homeless and domestic violence shelters, still force people into gender-segregated services. As you can see on this slide, 42% of those who have accessed homeless shelters were forced to stay in a facility designated for a gender they did not identify with, and that included 35% of those who had surgically transitioned. The basic dignity of being able to determine your own gender is critical, and unfortunately does not happen often enough. The result of these types of systemic discrimination can be that victims end up going back to their offending partner or back to dangerous living or social situations. Question 8. How many trans people have attempted suicide? 11%, 21%, and 41%.
Hi, Loree.
Yes?
Loree, hi, this is
Yes.
Katie. I'm going to pause really quick because we have a question, and I'm going to ask it and then leave it up to you if you would like to address it later or now. The question is, how do these numbers compare to numbers in rural Nebraska?
The answer to that is there's been no studies of trans people in rural Nebraska. So we cannot answer that question.
Okay, very good. Thank you.
Thank you. So you might be wondering why we are including suicide statistics in a webinar about sexual assault and domestic violence. Suicidal thoughts and actions are common for people who have experienced assault, and, as you will see, is extremely common for transgender individuals. As you can see, the disparity between how many non-trans people attempt suicide and those who are trans and attempt suicide is profoundly different, with only 1.6% of the general U.S. population attempting suicide and 41% or more of trans people attempting. We can imagine some of the reasons why trans people may be more likely to take action to end their lives. We know that due to the high rates of violence, discrimination, and other forms of abuse, trans people may be more vulnerable and may feel more helpless and hopeless. This is especially true if trans people are or underemployed and are living without insurance that would allow them to access competent mental health care services. As we saw in the previous slides, in the trans community there are high suicide rates and challenges with homelessness, and some who engage in sex work or other survival strategies. It's vitally important to see how abuse relates to other health factors in people's lives. On this slide, we can see 4 categories and a comparison of transgender people who have experienced intimate partner violence and compared to transgender people who have not experienced intimate partner violence. Intimate partner violence survivors were twice as likely to attempt suicide, 65%, than those who had not experienced IPV. Rates of homelessness are extremely different between IPV survivors and non-survivors. 48% of those who experienced IPV have been homeless at some point, compared to 9% of the non-IPV people. It's no surprise either that substance abuse is higher for those who experience IPV. 47% of trans IPV survivors use substances to cope versus 19% of non-IPV. And the last comparative statistic we'll share today is about those who engage in sex work or survival sex. IPV survivors are 4 times as likely, 29%, to engage in sex work versus their versus their peers who have not experienced intimate partner violence. These disparities are keen reminders that we need to look at barriers and needs of trans people who might be in abusive relationships. Their abuse impacts nearly every area of their life. There are two more data slides before we move on to discussing barriers. This slide may surprise some people. In Forge's 2011 findings, we saw that trans-masculine individuals overall experienced higher rates of violence than trans-feminine people. Most of the published data has noted that trans women experience higher rates of violence. While this may be true for hate-motivated violence and street-based violence, it seems to be less true for intimate crimes. As you can see on the slide, the rates of violence are close to identical in most categories for those who are trans-feminine and those who are trans-masculine. In some cases, trans men have slightly higher rates of violence. This chart on polyvictimization is also from Forge's 2011 survey. What this chart means is that 84% of people who checked the box for stalking, for example, who had saying that they had experienced stalking, had also experienced one other form of the violence listed, which again is hate-motivated violence, stalking, intimate partner violence, dating violence, adult sexual assault, and child sexual assault. This chart indicates that trans individuals are experiencing not only high rates of violence that we just discussed, but also multiple types of violence. At this point, that ends our data, and I'm going to turn it back to Michael.
Great, thanks, Laurie. So we're going to head into talking about barriers now, and we're going to be talking about barriers from a data perspective. So we're going to be looking at some qualitative data. Again, this data that we're going to be sharing with you is from the large survey that we did in 2011. We had 1,005 valid respondents, and we worked with this data a lot to try to piece out what some of the barriers were, what people's experiences were, and what we're going to talk about today are a list of barriers that are roughly in hierarchical order from most to least. But I wanted to note that we analyzed this data and looked at it from different geographic areas and many different ways. And there were some communities that ended up having very different orders of these barriers. So just keep in mind that your particular area may be slightly different in terms of the ranking of these barriers, but almost all of them are going to be relevant to any community. So we're going to go through 10 commonly experienced barriers that trans people face when trying to access sexual assault or domestic violence related services. So the first barrier, unfortunately, is around fear. And what we saw was just really pervasive fear in a number of different areas. So we saw that people were afraid of abuse by service providers, fearful of hostility or rejection or judgment or discrimination, again, by service providers, not necessarily from what they just experienced as sexual assault or domestic violence. People were concerned about being outed. They were very fearful of being outed, again, by service providers and sometimes by other clients. People were fearful of other clients, how people would respond to them. People were fearful of being denied services. And we know from other data, both from the National Center for Transgender Equality data and many other sources, that people are routinely denied services at extremely high rates. Trans people are often very fearful of police misconduct. And as we've been seeing in our country lately, there's a lot of talk about police misconduct, both in terms of race and in terms of other minority populations. And transgender people have a higher than probably average rate of experiences with police misconduct. And trans people are often fearful of being the only trans person in a room or in the group and feeling isolated because of that fact. So if we look at fear from a little bit of a different perspective, one of the ways that people may be outed as trans is through their documentation. So incongruent is in big quotes because it may or may not be incongruent with somebody's gender identity, but only 41% I'm sorry, 41% of trans folks do not have identification that matches their gender identity. And so what that might mean is that if somebody shows their driver's license or health insurance card, there's a good chance that their appearance and their gender identity doesn't match their driver's license, their identity documents. And sometimes providers can use that mismatch to deny services, or it may just make a trans person very fearful that they'll be outed as trans, and they may not even want to access services because of that fear. And one thing that a lot of providers ask me is like, well, why don't people just change their identity documents? And one of the answers is because people don't always want to change their identity documents. But one of the also important answers is that cost can be a major barrier. It costs money to change identity documents, and some trans people just do not have those funds. We haven't commented on a lot of the images, but the images that's coming up on the screen is one that I really love, that shows that that disparity between what somebody's driver's license might have on it and what the rest of their appearance is. So a masculine appearing person with a driver's license that has a very different image on it. So when we look at rural settings, again, the fear of being outed is really, really prevalent everywhere. But when there are small communities, people know everyone's, business and history, and sometimes people are not, haven't disclosed their transgender status to people. So small communities, information can travel fast, so people are worried about that. There also is concern around confidentiality and those dual relationships that people have. So people may know people in multiple contexts and may feel uncomfortable or unsafe accessing services with people that maybe they engage in social activities with, or go to church with, or see in everyday interactions. And people may also be fearful of splitting the community. And this may be about splitting the trans community if they come forward and seek care, or splitting the local community. So kind of a division of alliances with that. So the second barrier is around trans welcoming, or creating a trans friendly environment. So this is the second highest reason why people are not accessing services. And by trans welcoming, I mean, does a trans person sense that the environment and attitude are friendly and respectful? So this tends to be more about an individual provider's attitude, or the attitudes of an agency. It can also be about the little signs and signals that send the message of being welcoming. So one of the things that I like to kind of equate this to kind of make it more memorable is that being trans welcoming is like if I invite somebody over for dinner, I'm welcoming them into my home. I'm making a gesture of having a friendly and welcoming attitude towards them. So how this relates to trans people in a service context is that trans people have reported things like, questioning, will people be comfortable with me? Will I be accepted in this environment? Will people be hostile towards me? So one of the challenges in rural communities is that oftentimes, not every time, rural communities are a little bit more conservative and may have more traditional values, which may include homophobic or transphobic attitudes that are pervasive. On the positive side of that, rural communities are also doing a really great job in general of kind of taking after their own. So making sure that everybody gets taken care of, even if there might be some political differences. So the third barrier is around cultural competency. So by cultural competency, we mean, is an agency informed on how to respectfully treat trans people when they walk in the door? So this is about skills. So the first one is about attitudes, this one is about skills. So if we look at trans welcoming as the invitation to come over to my house for dinner, cultural competency is about maybe my cooking skills, and if I'm actually going to prepare a meal that is safe to eat and won't create food poisoning for somebody. So it can also go a little bit farther into a cultural realm of, do I know you well enough to know that you're Jewish and you don't eat pork? Do I know that you're gluten intolerant? So how can I I know you and be culturally competent, culturally responsive to your needs in creating a meal that is safe and prepared with skill and things like that. So I know that's a little bit of a weird example, but I like to compare those two because they're really different between being trans welcoming, which is important, and being culturally competent, again, around skills, which is equally important. So when we go back to a DV or SA context, trans people might be wondering, will I be asked invasive questions? Trans people can usually tell many stories about how many times they've been asked about their genitals or their surgical status, which is almost never appropriate. Trans people might be wondering, will they use my name and pronouns correctly? Will I have to educate my provider? This is a major concern of trans people who are regularly paying for services, but then end up needing to educate their provider. So when a client is in crisis, this is not the best time for them to act as a teacher. Another question that people are commonly asking is, can they deal with my body? So many trans people are not comfortable with their bodies or have bodies that are often just uncomfortable in terms of their alignment with their identity and their bodily experience. And so if they need medical care or a forensic exam, that may be really challenging of, is a provider going to treat a trans body, the trans person and their body with respect and care? So if we look again at how cultural competency plays out in rural communities, again, we know rural communities are smaller and possibly more conservative. And because of those things, and because of many times we have people that are working many jobs, overworked, and trying to play many roles, there might be staff that's less trained on transgender specific issues. So that cultural competency just plays out in terms of how much training or exposure has somebody had to transgender people and transgender issues. So the fourth barrier is about not knowing what a service is or finding that it's unavailable. So one thing that we found was that a lot of people didn't know what certain services were. Like a common example was that people didn't know about crime victim compensation. So along with not knowing what a service was, many people were uninformed about what might be involved. For example, many people thought that they had to engage with the police in order to have evidence collected, which is not true in almost every area in the country. So there might be some truth to what people believe, but oftentimes there's some misconceptions or misbeliefs. So if we look at rural communities and people not knowing what services are or not knowing if they're available, we know that rural survivors may not have access in their area. The nearest rape crisis center or domestic violence service agency might be dozens, if not hundreds of miles away. So it literally may be kind of out of reach for people who live in remote areas. And the other piece of this is that a lot of times trans people in general and rural trans people in particular, and especially youth, often look for support online. And we all know that online access can be really great and can connect us to really positive and accurate information, but it can also connect people to untruths and untrue information, and may lead people to believing that there's no hope or there's no services for them. So reputation is the fifth barrier that I'll share with you today. And although it ranks as number 5 in this list, I really want to stress that this is something that is very, very important to trans people. And it comes up in a lot of different ways. And when we ask people questions about what's important, this is really something that comes up a lot. So the trans community is very interconnected and tightly knit. So when one person has a negative experience at an agency or with a particular environment or provider, the word spreads extremely quickly. One person's negative experience, they might share it with somebody else. It can dramatically influence an entire community and paint a service agency as being unwelcoming or culturally incompetent or any number of other negative things. It might not be true, so somebody might be spreading some comments that are not true, but that spreading by word of mouth really influences an agency's reputation and the willingness of other trans people to seek services there. So again, one negative experience can really quickly reverse a positive reputation that an agency has or really taint it very quickly. And it's very difficult, unfortunately, to regain that sense of trust within communities. And again, it's not necessarily that an agency is doing something wrong, but it's about what does get spread through the community. So when we look at how this impacts rural communities, we know that there's oftentimes a broad range of services that are provided by a single agency. So if somebody's experiencing different things throughout their life, they may end up having to go back to that same agency. So if they've had a negative experience at one agency, and they have to go back there again, that may be very difficult if they didn't have a good experience. So there might be some safety concerns again around reputation. And again, it can't be stated enough. I think people, everybody knows everyone. So how does that reputation fold in when people know a lot of everybody's business? So the sixth barrier is around an agency being woman-focused. Sexual assault and domestic violence movements have emerged out of the women's and the feminist movements. And violence against women has been the focus of many anti-violence programs and agencies for a long time. And we know that times are changing a bit, partly due to the fact that non-female survivors are stepping forward and not tolerating sexual abuse, sexual assault, and domestic violence. So think about things like the Penn State issue with all of the abuse happening on campus and in that community, or the priest abuse cases. So we're seeing an increase in public visibility of male survivors. We're also seeing an increase in transgender survivors who are able and willing to be open and disclose their survivor status. However, a lot of agencies still have an agency name that's very female sounding, the Women's Center or Kathy's Home, or something that sends a clear message to people that that agency serves women. And so people wonder if they're not identifying as a woman, so if they're male identified or if they're transgender in any way, they may wonder if they would be welcome there. A lot of times what we see is that the agency's language may be only referencing women. So on a website, they may only use female pronouns or female examples or female images. That really sends a message and can create a feeling of erasure for transgender people who would like to access services but are seeing messages that say, we don't really welcome you here because of how we talk about survivors and what we show of survivors. And all of those things together can really create a sense of hopelessness of where somebody feels that they can seek services. And oftentimes that translates to people thinking that they can't seek services anywhere. So when we look at rural communities and women-focused, again, some rural communities may have more traditional beliefs and traditional models of service. So it might be a little bit older school where focusing on women was the norm before, and maybe things haven't changed in some communities. And again, sometimes things have changed, but those traditional beliefs may impinge on a survivor's willingness, a transgender survivor's willingness to make that phone call or enter the doors. So the seventh issue of barrier is around shame, embarrassment, and stigma. And of course we know that these three generalized topics are really, really common for just about every survivor. There are some trans-specific themes that go through this that might be a little bit different. For example, if they need or want medical care or a forensic exam, they're likely going to have to add in that additional layer to wade through, and it may create a sense of embarrassment. For example, if a trans man was vaginally sexually assaulted, it may be difficult for him to seek care for that part of his body, and it may be both more physically painful or emotionally painful to even think about having a physical exam related to that part of his body. There may also be concerns around trans people who survive through sex work. So these trans people may be worried about how others will react to their employment, may wonder if they will be blamed for the type of work they do. They might be concerned that they won't be treated respectfully. There's clearly a stigma associated with sex work, and that may be a fear that comes through. And included in the reasons for why some folks are not accessing services is the belief that some trans survivors have that sexual assault can't happen to me. And we're seeing this a lot with trans men who transition and are oftentimes male appearing and really comfortable in their masculinity. And sometimes what happens is their belief is, it can't happen to me because sexual assault doesn't happen to men or domestic violence doesn't happen to men. And so when it does happen, it can be really devastating, and it can really rock their world in a very devastating way. So when we take shame, embarrassment, and stigma and we put it into a rural context, there might be some complicated issues around self-blame. So it may be due to the isolation of not knowing many other trans people or being connected to other trans communities that might help trans people kind of normalize their experiences, their identity, the things that are generally faced every day. Many trans people may also choose to live in smaller communities because they appreciate the isolation of not having so many people around. Others may not, others may know of their trans history and they may keep it to themselves. If they seek services after an assault or an abusive interaction, they may need to disclose their trans status or their trans history to a service provider, which might bring about some feelings of shame or stigma. So this is going to be true in rural situations or in urban situations as well. So since people know each other in smaller communities, it might be difficult to broach the subject of being trans if others don't already know, because trans people might be worried that if they disclose in one setting, it may not be confidential and it may spread throughout the community. So number 8 for barriers is about making things worse. As Laurie showed us earlier, polyvictimization is really common. So a lot of times by the time a trans person as an adult is potentially seeking services for sexual assault or domestic violence, they may have experienced previous incidences of other forms of harm. So they might be concerned that seeking help now will trigger past memories or remind them of previous unhelpful experiences or negative experiences with service providers in the past. People are always wondering too about, like, if there's a lack of knowledge, and that's not just for providers, but sometimes survivors don't have the knowledge that they don't have to tell their story like to the police, like I mentioned before, or that they may not even need to disclose that they're trans if they have perhaps like a cut on their arm that they need to have stitched up. So sometimes people are not in the know about what rights they have and what things they can do so that they can make their experience a more positive one instead of making things worse. So if we go back again and look at rural communities and how this concept of making things worse is a barrier, a lot of times people think that there will be retaliation. So small communities, people may know that they went to the police, went to a sexual assault agency, and they're fearful of retaliation. And sometimes those retaliations move into a single person who's the offender to more of gang assaults as a secondary assault. You know, when I was preparing this, I was thinking about the film Boys Don't Cry and Brandon Teena and how in small communities, sometimes there's this attitude and this belief and this kind of ganging up on folks who are different or who are marginalized. One thing that we all know too is that in small communities we can't always get away from certain people, and that means we can't necessarily get away from a perpetrator or an offender either. And there might be some pressure to not air out dirty laundry. So people may feel the concern that they can't come forward because if they talk about it, it will make things worse for their community. Again, their trans community or their rural community geographically. So barrier number 9 is around systemic problems. And again, this is something that is true for both trans survivors and non-trans survivors. So people are concerned about not being believed, about how legal systems might re-victimize people, about having few successful prosecutions, or needing to jump through dozens and dozens of hoops in order to get access to services or prosecution or legal help. And a lot of times that means waiting for months and months without any justice happening. So a lot of those are really common for any survivor. And some of the additional things for trans folks might be some issues with documentation or the consequences of getting a restraining order, which may out them in the process of doing that. There are lots of things that can be trans-specific, as well as the regular problems that every single person might be experiencing when accessing systems. So when we look at what might happen systemically in rural communities, it's possible that healthcare providers and law enforcement agencies and other service providers may be few in numbers, geographically dispersed. So there may not be as many people literally that are doing the work that can help people with those legal and healthcare challenges. There may also be some social inequities that affect healthcare and justice options. It may be in terms of economics or any number of other factors that go into that. So the last barrier I wanted to mention is about cost. And one of the things that we know in great detail is that trans people experience low-paying jobs, are often unemployed, experience discrimination when they are employed. Laws don't always affect if somebody stays employed or if discrimination is happening. So what that oftentimes means is that people have no or minimal health insurance. It may mean that people have high out-of-pocket costs. So if they're on hormones, they may need to pay for their hormones out of their own income and not out of health insurance, which decreases the amount of money that they have for other things. And one of the ironies is that sometimes agencies have free services, and sometimes people think that if something is free, it's going to be poorer quality. So there's kind of a catch-22 there of when agencies do offer free services, is there a concern by the users that it's going to be lesser quality? So one of the things that I wanted to bring up when we look at cost is kind of the Maslow's hierarchy of things. So because trans people may be living at poverty levels or below, there might be more of a need to have food and shelter than there is to get care following a sexual assault or domestic violence incident. So, it might be far more important for the person that's seeking care to have a sandwich offered to them than to have their medical or emotional needs taken care of. So that's something for us all to think about is, do we make sure that somebody has their basic needs met before we move on to helping them with other issues? So again, in rural communities, cost may play out just by the fact that some rural communities are very poor as a whole community, and some of the agencies in those communities may also have limited resources or be not as flush as agencies in larger cities. So just a quick kind of catch-up reminder that everyone deserves to have access to healing services and not have their life be ruled by trauma. So we just talked about a lot of barriers that make it challenging, and there's not always easy solutions, but we're going to talk about some of them in a minute. And one of the things that I wanted to remind folks of in a rural context is that, again, trans people are diverse. Rural communities are also diverse and complex. And it's true that trans people do live in the country or in small communities or in remote areas. And trans people don't always live there because they have to, but sometimes trans people live there because they want to, and they find happiness and joy in being in those rural communities. So as I mentioned in the very beginning, we wanted to mention shelter because it's a really important issue, and it's also something that we could spend days and days and weeks talking about. So I'm going to point you more towards resources and some concepts, and we're going to not talk too much in detail about the nitty-gritty of shelter. So one of the things that I think many of us think about are, this kind of the difference between something being moral or the right thing to do and something being the law or what's required. So providing safety and shelter to all survivors is both the right thing to do, and in a lot of cases, it's also required by law. So it's really important to know, like if you receive Violence Against Women funds, that there's a requirement to serve all people. Lori, would you be willing to step in and read this slide for us?
Yes. No person in the United States shall, on the basis of actual or perceived race, color, religion, national origin, sex, gender identity, sexual orientation, or disability, be excluded from participation in, be denied the benefits of, or be subjected to discrimination under any program or activity funded in whole or in part with funds made available under the Violence Against Women Act, and any other program or activity funded in whole or in part with funds appropriated for grants, cooperative agreements, and other assistance administered by the Office on Violence Against Women.
Thank you. So this is one of the critical statements that is in the frequently asked questions that was developed by the Office for Civil Rights. And for those of you who don't know, the Violence Against Women Act was reauthorized in 2013, and President Obama signed it into law in 2013. And one of the really great things for transgender people is that, as you can see in this quote, gender identity is now included in a protected class and needs to be honored. So what I'd like to do is to just show you where you can access more information. And we strongly encourage you to look at the FAQs that are developed by the Department of Justice. So these guidance were created on April 9th of 2014, and it's a really easy read. It provides answers to commonly asked questions that OVW grantees might have about the new non-discrimination provision. So I really encourage you to look at it and start having some discussions in your agencies about sex-segregated services and sex-specific services and where you can reach out for more information. So I wanted to point out a couple of other resources to you. One is an article that we wrote based on the ask of the National Resource Center on Domestic Violence. They really wanted to look at sheltering trans women and providing more welcoming services. So this article is currently available, and we are in the process of creating 2 additional documents, one on sheltering transgender men and one on sheltering gender non-binary individuals. So hopefully by the end of the year, those 2 documents will be out, as well as a couple of other documents on shelter. One of the things that is really critical to anyone who's in an abusive relationship is around safety planning. And a lot of times it's difficult to know what some of the differences are based on cultural diversity and different populations. So a couple of years ago, we developed a safety planning tool that is specific to transgender issues and transgender people. So the URL is on the screen, and we'll mail this out to you as well. And we encourage folks to look at this, whether somebody is able to access shelter or not access shelter. This tool is really helpful in looking at trans-specific concerns. It's IPV focused. It can be used as a self-help tool for trans people who are experiencing domestic violence, and it can also be a useful guide for service providers to walk through with their clients. So let's take the next couple of minutes to talk about what you can do. And I'm going to zip through this fairly quickly because we've talked about a lot of these issues already. So the first one is the reminder of the terms paradox. So terms are crucial. We want to listen to what our clients are saying, use their language, show respect by using that language, and also know that what their words are not necessarily what we need to know to better serve them. So this is the reminder to listen carefully and ask the questions that are necessary to providing services. The second reminder and practical tip is around the master status concept. So we want to kind of say no to the label of primary potency and say yes to this and both kind of mentality. So yes, you're trans, and you're an assault survivor, and you're a person of color, and you're disabled. What do we need to say yes to? What do we need to listen to? So again, this is about listening carefully to our clients and being responsive to their needs. Another action step is around having inclusive forms and systems. So one of the first interactions that a survivor may have with your organization is the information that might be gathered by somebody doing a phone intake or what they fill out as an intake form. So you want to make sure that your paperwork and your computer systems allow for options that might fit trans people. So have call logs that have multiple options for gender, not just male and female. We want to have intake forms, again, that have multiple options, not just male and female. May want to look at other things like relationship status. Is it only referring to heterosexual couples or people that are in monogamous relationships? Looking at things that show the diversity of who might be entering your door. Name and pronouns are really critically important for all of us. I think we all like to hear our correct name and our correct pronoun. And so I really encourage you to ask the person and ask all of your clients what name and pronoun they use. Listen carefully to what their response is, remember what their response is, and then consistently use that name and pronoun that they shared with you. And we kind of modeled this in the beginning because somebody did ask the question, but one of the ways that we recommend asking is when you introduce yourself to a client, you can say, "Hi, my name is Michael. I use he, him, and his pronouns. What name and pronouns would you like me to use for you?" So that's one way of just saying, "Hi, I'm acknowledging that pronouns might be different than what my expectation is." Bathrooms are also something that is critically important for folks. A lot of trans people experience violence and harassment in bathrooms. So as an agency, it's important for us to make those environments as safe as possible and as comfortable as possible for trans clients as well as all of our clients. The image that's on the screen is actually a fairly new all-gender restroom that's in the White House. So that's like a super cool new addition to the White House. But we know that sometimes agencies cannot change the physical structure of their building, so you might not have the option of making an all-gender restroom if you're renting space in another building. But one of the things that you can do, if you can't designate a bathroom that is private or single stall, is to have signage up in those bathrooms or signage up in your agency that says, "We respect people's right to use the bathroom that aligns with their gender. We expect people to be treated with respect with regard to what bathroom they use." So those are important ways of trying to make a safe environment for people so they can take care of some of their basic needs. Another action step is around having LGBT materials in your waiting room or in your literature racks. And we know that sometimes having trans-specific literature is just too small of a population. So we do encourage you to have a subscription to a national LGBT magazine, or if your state has an LGBT newspaper, to have that available. But I also wanted you to know that we have materials that we can send you. It's not geographically specific. The brochure that's on the screen is It's Never Too Late. We'd be happy to send you as many copies as you'd like of it. And you can have it in the back office or in the front office and hand clients that are trans this brochure that will help them feel that they're seen and heard in your office. So another action step, and this is more of a homework step, is again around the VAWA non-discrimination conditions. So I really encourage you to do the homework of downloading the frequently asked questions, reading them, and having some discussion with other staff members and other community members about what you need to do to kind of reach that point of better serving all of the people who are protected classes and all of the people just in general who need services. Another action is knowing what resources are available. So I'm sure that most of you know what resources are available in your community in terms of sexual assault or domestic violence, but do you know what LGBT resources are available or what trans groups are available? And also, do you know what the national landscape is for resources that are available to you? If you're on the webinar now, you know about Forge and the fact that we have resources. So I encourage you to reach out to us for some of those resources. Reach out to us to help get your clients the resources that they need as well. Another action step is around addressing the survivor's needs. So address the needs that they have, not the needs that you might think that they have. So stay focused on what your client's telling you and get them connected to the resources that are appropriate for their needs. And keep learning. is it's something that's kind of obvious, but I know I'm somebody that really likes to continue to learn, and I think those of us who are always asking curious questions in a professional way, not to our clients, but asking questions about, well, I need to know more about this, oftentimes end up doing better work when we actually see clients. So I encourage you to check out both Forge's resources as well as the hundreds and hundreds of other resources on trans people, as well as trauma-informed care and anything else that you may feel the need to expand your knowledge on. And this slide is something that I think is really obvious and logical to a lot of people, but the reminder that all survivors need to be believed and heard. And one of the things that I keep on hearing over and over from trans clients is that what they value so much in providers is when people have patience. Because trust doesn't always happen very quickly with trans people who have experienced harm in situations in the past. Having a sense of persistence, so that's kind of keeping an open door and just gently saying, I'm still here for you, I'm still here. And having compassion, and oftentimes I think that compassion goes far farther than having actual trans-specific knowledge. So having those just basic human client-centered care things in the back of your head and putting those into practice may actually serve your clients better than having bookloads of knowledge. And one of the things that I wanted to share with you as we end up today is this quote from our colleague Helen Boyd, who posted this on her blog a couple days ago, and this is a great reminder for all of us. So she said, maybe I've been doing this too long, but in preparing to do a presentation for a local organization this week, all I keep on thinking is that I want to walk in and say, trans women are women, trans men are men, and some people are neither or both. Don't worry about their genitals, their socialization, or anything except whatever services you're providing for them. Ask everyone what name and pronoun they prefer for themselves, and then use them. Then she writes, N, Trans 101. And obviously, I know it's not that simple, but it really kind of is, isn't it? And I thought that was a great summary of kind of what we've talked about today, and a great summary in general. So just a couple more slides. I want to remind folks that you can find us on the web at forge-forward.org. Lots of webinars, lots of resources online, lots of ways to contact us. If you'd like to be informed about what's going on, both what we're doing as well as what's going on in the community for more resources, we really encourage you to follow us on social media, Facebook, Twitter, or Instagram, where we have an active presence on all three of those platforms. And before we open it to questions, I just wanted to make a shout out to our funder, Office on Violence Against Women, who we're really grateful for that they continue to fund us to do webinars like this and other trainings across the country and be able to support you in the work that you're doing. So I'm wondering if Laurie or Michelle or Katie have gathered some of the questions that we have that people have asked along the way.
Yes, I do have a question. We answered most of the questions that we went, but someone did ask, what gender should a transgender person put on their driver's license?
I'm sorry, there was a little bit of cutout. Could you repeat the question?
Sure. What gender should a transgender person put on their driver's license?
That's a good question. Laurie, do you want to answer that? I'm happy to answer it.
Yeah, why don't you answer it?
The basic answer is whatever gender they would like to have on their driver's license. Some trans people like to have a new gender marker if they move into, if they transition or move into a new social presentation of their gender. Sometimes people like to maintain their original gender marker. It really depends on the person.
Michael, would you say that that's this? Would it be a similar response if it's something like a tax form, like if they needed to fill out a W-9 form for a job or something like that?
Yeah, that's a little bit different. Generally, I mean, that's a legal form, and generally what a person will want to do is have the name that aligns with their legal identity, and legal is in major quotes because it's hard to know which document is legal. Oftentimes for work, people use the name that's on their Social Security records. And again, those records can be changed, but sometimes people haven't changed them yet or don't want to change them.
One of the things to note about a driver's license is that this is what you present to the world a lot of times. And if the picture and the information on the card does not line up with the person they see in front of them, there can be a lot of problems. Just imagine a police officer pulls you over and you produce a driver's license that shows you as male, and what the police officer is seeing as the woman. The police officer may assume that this stolen license or that it's some attempt to be fraudulent. So that is one of the things that trans people have to think about, is what are the risks that I'm running when I put my identity out there, and which identity do I put out there?
And obviously,
okay,
yeah, I'm sorry.
Yeah.
Just to add on to that, there's obviously sometimes a conflict between what somebody's identity is and what they may feel they need to do for safety. So some people may change their identity documents because it creates a safer environment for them, like Larry just mentioned, being pulled over by the police or having to show ID at a bank or something like that. Sometimes it feels safer when that document looks and feels the same as what people are seeing in front of them. And some other people say, I'm not going to do that because that's not what my identity is.
Okay, another question that we answered privately, but that I'd like to put to you publicly, is there was some questions around when you talked about transgender people being assaulted in public bathrooms. And one of the questions was, the door is closed. How do people know that someone is transgender?
That's a really good question. And this is kind of a politically sensitive area to talk about. Sometimes people perceive other individuals to be something other than male or female, non-trans male or female. And so they may make a lot of presumptions about somebody's gender identity based on their appearance. So they may be assaulting somebody not behind the closed stall door, but as they're walking in or out of a restroom. And it really is oftentimes based on what somebody looks like, how they're presenting their gender, not necessarily what their gender identity is. Does that make sense?
I am waiting for more questions to come through. So this is your opportunity to ask another question if you can type it in the next minute or two.
And I do have one. This is Katie. I do have one from earlier that I thought I would bring up at this time. A person says that they were hoping you, Michael or Larry, would cover transgender versus transgendered with the ED on the end. This person says a lot of well-intentioned people get tangled up in the extra ED, on the end in our community, and there's been some backlash there. So do you want to discuss the difference between the terms?
Sure, definitely. Right now, there's been a lot of community shifting in language, and a long time ago, actually not a long time ago, not too long ago, transgendered with an ED at the end of it was fairly commonly used within the trans community and outside of it. And in the last probably 5 or 10 years, that language has shifted to no ED at the end of it. So what we're seeing, though, a lot of times is that the word transgender with no ED is kind of what the politically correct language is. It's the language that's used by people who are writing about trans issues. And it's oftentimes in more academic settings and in larger cities or people who are politically active. What we notice a lot is that smaller communities who may not have access to other transgender people, other transgender support groups, providers who don't necessarily have access either, haven't caught up with the change in the trend of what language is being used. So I would strongly recommend that that people use transgender with a no ED at the end of it, just because that is currently what is most commonly accepted.
However, you may have clients that describe themselves as transgendered. I have 2 other questions. What is the actually I have several, which you probably can't answer. What's the best introduction to transgender issues book that you would recommend, and what would a changed intake form look like?
Best transgender book. I would recommend Ari Lev's book, and I'm blocking on the title right now. Laurie, do you remember the title of Ari Lev's book?
Emergence, I believe.
Emergence. If you Google Ari Lev, ARILEV, you'll find her book, and it's very long, but it's a very solid book. That's the place that I would recommend to start. And the second one was, what was the second question?
What would an intake form, changed intake form, look like?
I would be happy to send people some examples of that, and I'm aware that we're basically out of time today, but I would be happy to include a sample intake form when I send out the follow-up. And I am aware that we are out of time, and I think now's a good time for us to break. I would be more than happy to answer other questions if people would like to email either me or Laurie. I wanted to thank again the Nebraska Coalition for asking us to be part of this today, to kind of run the show today, and for all of you for being here and listening to such a very dense time and dense topic. So thank you for being here. We will be sending out the evaluation that will go directly to the Nebraska Coalition, and we'd be happy to entertain any more questions by email or in any other way following the webinar. It'll be available for reviewing if you want to share it with your colleagues, and we'll post it on the Forge website, and I believe we'll also have it available for the Nebraska Coalition if they'd like to share that as well. So thank you, everybody.
We would, Michael. Michelle with the Coalition. I want to just take a moment to thank Michael, Lori, and Katie with Forge for doing the webinar for us. And I'd also like to remind people that if you would like a certificate of attendance for the webinar, the Nebraska Coalition will be handling that. And you can call me at 402-476-6256. You can also email me at Michelle Z, and it's Michelle with 2 L's and then the letter Z as in zebra, at nebraskacoalition.org. When you get a copy of the PowerPoint, that is towards the beginning, but I wanted to share it now as well.
Great.
Thank you all for participating.
Thanks very much, everybody.